Good day. We're going to talk a little bit today about fat grafting. It seems like people are very much so interested in that, and sometimes there's some misconceptions. So we're going to talk a little bit about what fat grafting is useful for, what it's not useful for, and what recovery things are like that. So what is fat grafting? Fat grafting is taking a person's own body fat, harvesting it, and then transplanting those living cells to the face. We harvest it through a little tiny incision placed on the body wherever somebody's got additional fat that they can spare. We then take those cells and we put them into this special system called pure graft, where they get washed in physiologic solution to get rid of all the stuff we don't want to put back in. And then we transplant it by just making a little needle poke, whether on the front of the cheek or temple or wherever it needs to go. And then we take a blunt needle, we call those cannulas. The ones we use are about 1 millimeter in diameter, so they're really quite small, and we just transplant those cells into the areas of the face that are in need. So fat grafting is primarily useful for helping with shadows. So understand that when the face ages, it kind of ages in 3 ways. It ages in the ways we think about, which are gravitational, which is things like sagging neck and jowls. It ages in the way that the skin ages, so brown spots, wrinkles, and those sorts of things. But the third way that people don't really necessarily think of is that we get these shadows that happen. And the reason those shadows happen is because we literally get bony skeletal changes as we get older. So our orbit, this bone that encircles our eye, starts off round and pronounced as we're youthful, and then as we get older it kind of elongates and stretches out, which leads to this volumetric loss in the lower eyelid cheek area. So if you think about that, the cheek lowers, which also causes the lower eyelid to elongate, and you end up with a shadow. So that's kind of the most classic kind of orbital groove that people talk about, these dark circles and volume loss. That's kind of the primary area. So it's really about building the cheek back up and also elevating it so that it kind of fits into the lower eyelid in a more higher position and takes care of that shadow. So that's kind of the easiest place for people to kind of understand. But you also get volumetric changes elsewhere too. Some people get profound temporal volume loss. Some people get brow volume loss and forehead. We also lose bony volume of the mandible, which is part of the reason why jowling shows up. And so filling in front of that jowl and what's called the prejowl sulcus is another area. So all of those kind of bony, immobile parts of the face, that's really the bread and butter for fat grafting. And again, it's really about just getting rid of shadows, taking care of all of those irregularities in the face and creating one nice youthful convexity that these overhead lights in this world we live in can bounce off the face. The other area where we do put fat sometimes is around the mouth. But if somebody's looking for that area in isolation to be improved, it's not really a great option to do fat grafting because the mouth area moves a whole lot. And so when you're taking a living cell and trying to get it to survive in the face, and it's got to get connected to a blood vessel and become vascularized, if you put those fat cells in an area of the face that's moving all the time, it's really tough for that to occur. So if we're doing fat grafting in the more immobile, bony parts of the face where it's really intended to be done, and we've got some areas around the mouth that could also use some fat grafting, we'll put it in there. But you have to understand that the take, or the percentage of the fat that's going to survive in the face, is around 50%. Around the mouth area, it's maybe 10 or 20%. So you just have to expect less volumetric take to occur in the mouth area. But like, for example, in the lips, you're not going to get really big augmented lips per se, but those little kind of dry, dehydrated cracks in the lips, those kind of get this hydrated appearance, and it really will give you some improvement as long as your expectation is set appropriately. They're not going to get a ton of volume from that. So fat grafting is oftentimes done alone. It's oftentimes done in conjunction with facelifts. We're usually using some IV sedation to do that. It does have some recovery associated with it, so you'd think because there's really no cutting and real surgical involvement in this procedure, it's really just needle pokes and cannulas. But because you're distributing those fat cells in multiple planes and making multiple passes, trying to put small amounts all over the place, it does create some bruising and swelling. You also have to accommodate for a little bit of the loss because you're not going to get all those cells to take. You're going to lose a certain percentage. You have to overfill a little bit. So it does have somewhere between 2 and 3 weeks of kind of visual social recovery time, and even beyond that, little pockets of swelling and things that'll persist. And it takes about 3 months for us to really figure out how much of that fat took or didn't take, and what areas did or did not. Usually people are pretty happy with the degree of improvement, but it is really easy in those individuals who didn't quite get as much take as they need to add a little bit more and to bring the volume up to where they're happy with stuff. So that's an overview of fat grafting. Hope that was helpful and educational for you, and we look forward to seeing you soon. Have a great day.
Are we getting rid of that?